My name is Chatchai Kunavisarut from Thailand, and my topic is titanium or ceramic implant in the aesthetic zone. I've been working with dental implant for the past 20 years, and of course, I use a lot of titanium implant, and also in the aesthetic zone, which I don't have any problem with titanium implant in the aesthetic zone at all. However, that increasing demanding about ceramic implants. There's some literature state that increased titanium concentration was found close to titanium implants and regional lymph nodes. And some studies say patients who suffer from multiple allergies or with a history of allergy to metals have a greater risk of developing a hypersensitivity reaction to titanium implant. And also incidence of allergic reactions to titanium dental implants may be underreported as a possible etiological factor in implant failures. There's also some case report that say some patients have allergic to contact dermatitis caused by titanium screws and dental implants. And this case report was published in Journal of Prosthodontic Research. Patient have 2 implants in the mouth. Patient has been tested that he has allergic sensitivity to titanium. And after removing these 2 implants, all the allergic reaction disappeared. Another studies in Journal of Prosthetic Dentistry in 2008 reported case report that this lady have 2 implants in the mandible to retain an overdenture. 2 years after implant placement, she developed some rash around her face. So they decide to remove the implants. 1 week after implant removal, as you can see, the rash is getting even worse because of a titanium debris from removing these titanium dental implants. And then 10 months after implant removal,